Hey, back with another update. My name is Crystal, 52 years old, recent diagnosis of systemic lupus. I had an appointment last week with a neurologist. He told me that there was no permanent damage to my central nervous system. I'm still having neurological symptoms, numbness, tingling, heaviness. I don't feel hungry most of the time. Weight gain, like I've gained a little over 50 pounds since February. Don't know why. My diet hasn't changed. But today I'm going to it's affecting my cognition. I wanted to make sure this is documented as well, because it does cause brain fog, or what they say is brain fog. Actually, I sometimes forget what word I'm trying to say, so that's a real thing. But this is just proof of it. So if you see me hesitate to say the right word or fumble over my words, that's part of it. But I wanted to make sure to draw attention to it, so that if anybody else is experiencing that, they'll know that's another thing that can happen. But I'm going to a cardiologist today because when I was hospitalized back a couple of weeks ago, my troponin level was elevated. Now, the ultrasound that I had done in my heart, and they did the stress test, all that stuff came back normal. EKG shows a heart anomaly from back when I was 32 years old. I was just born with it. But I have to see a cardiologist today for a follow-up. I guess they'll decide if they want to do a follow-up EKG or do any more labs, or if they just want to say, hey, you're normal. But my rheumatologist wants to rule everything out. I am supposed to go back the 19th of this month to my rheumatologist for normal follow-ups, lab work to see how effective the medication is. But I'm still having the neurological symptoms. I do have joint pain at times, but the neurological stuff is the worst. I can tolerate the pain. I have a pretty high tolerance, but it's just the neurological symptoms and the cognition issues and the fumbling over my words and trying to articulate is difficult sometimes, as you can tell in this video and my previous videos as well. I'm going to ask my rheumatologist to refer me to a neuroimmunologist and see what she thinks about doing that. So maybe they can correlate, because I had a CT of my brain. I had an MRI of my brain that shows 3 ischemic areas on my brain. Of course, they can't tell how long ago they've occurred, and it can be normal, but the fact that I'm having neurological symptoms tells me that's significant. There's got to be a correlation there. But the neurologist I went to told me that there was no permanent damage. I'm not sure if I understand that. But anyway, I just wanted to give an update, and then I'll notify everybody and let people know what the cardiologist says today. But I just wanted to do a quick little update, and also continue to stress the importance of getting a proper diagnosis in a timely manner, and emphasizes the importance of maybe getting the Avise testing for connective tissue diseases or disorders, and also prognostic testing, because it can tell you what body system your autoimmune disorder is likely to affect based on that prognostic testing, which is very important. So if you have a diagnosis, then you can have that done and maybe get ahead of it before it actually causes damage or permanent damage or starts attacking. But hope everybody's having a good day, and I'll let y'all know what the cardiologist says today. Bye.